I will start off with the definition of socioeconomic status. According to Science Direct, it is a measure of an individual's economic and sociological standing. It is a complex assessment measured in a variety of ways that account for a person's work experience and economical and social position in relation to others, based on income, education, and occupation. Socioeconomic status has been a powerful determinant of health. As a general rule, wealthy people tend to be healthier than people of poorer status. The image displayed shows that there is a correlation between obesity and age by being aware of the socioeconomic status and the barriers that it holds. If you are aware of the barriers, as an educator, you can break them down for inclusion and support the Active for Life model. When an individual is active for life, they hold a lower chance of being obese at an older age. The image being displayed shows that only 33% of children are meeting physical activity needs. As a physical educator, it is important to ensure that all children are on task to meet guidelines during school-designated time for physical activity. This image is showing the amount of physical activity between boys and girls. It is clear that males are more active. It has stayed steady over years, but it needs to increase because in Nova Scotia, 35% of the population is obese. By implementing physical activity, it is hoped that they will develop a passion for physical activity and being physically active, therefore leading to a healthier lifestyle and lower obesity rates. This image came directly from the Statistics Canada website. 5.1 Canadians had income below 75% of Canada's official poverty line in 2017. 12.7 of Canadian households experienced housing need in 2016. 11.2 of Canadians 12 years and older reported not receiving health care when they felt they needed it in 2014. 8.3 of households were food insecure in 2011 to 2012. It is important to foster learning and provide successful environments as an educator because, as shown in the image above, it lowers obesity rates, therefore lowering the burden on the healthcare system. First, I will start off by defining social determinants of health. According to the Center for Disease Control, conditions in which people live, learn, work, and play affect a wide range of health risks and outcomes. These conditions are known as social determinants of health. According to the Government of Canada, the social determinants of health influence the health of populations. They include income, social status, social support networks, education, employment/working conditions, social environments, physical environments, personal health practices and coping skills, healthy child development, gender, and culture. Lastly, according to the World Health Organization, the social determinants of health are conditions in which people are born, grow, live, work, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. Number 1 is Indigenous ancestry. According to the National Collaborating Center for Aboriginal Health, it is beyond health behaviors, and the evidence is clear that social determinants of health are the individual effects on inadequate social determinants of health and diminished physical, mental, and emotional health experienced by many Aboriginal peoples. Individuals with disabilities are often excluded and provided with less opportunities. The early child period is considered to be the most important developmental phase throughout the lifespan. This includes mental health, heart disease, competency and literacy and numeracy, criminality, and participation through life. Each equally important strongly influences well-being, obesity, stunting, physical, social, emotional, language, cognitive domains, which develop in early life. Education plays a role in shaping employment opportunities. It can also increase the capacity for better decision making regarding one's health, providing scope for increasing social and personal resources, and this will most likely predict if they will further their education. When you have employment and good working conditions, a good paying job, it makes it easier for workers to live in healthier neighborhoods, provide quality education for their children, secure child care services, buy more nutritious foods, which all affect health. Good jobs also tend to provide good benefits for yourself and family. Food security is based on the basic need of health, what food and enough food, so to make sure that your family is being provided good, nutritious food and enough for everyone. Food insecurity means that you cannot access enough healthy food due to a financial constraint. Gender inequality leads to the health risk for women and girls globally. And addressing gender norms and roles leads to a better understanding of how the social construction of identity and unbalanced power relations between men and women affect the risks, health-seeking behavior, and health outcomes of men and women in different age and social groups. Geography is a determinant to your access to food, healthcare, services, education, and employment opportunities. The lack of healthcare can lead to a worsening of symptoms and a shorter life expectancy. Without housing, an individual is more likely to have mental health issues. With no civic address, that means no mail. This can lead to difficulty getting a job. As an immigrant, you are more likely to face more discrimination and barriers due to the lack of dialogue. Your religious practices will most likely fade away, since you will most likely be a minority, losing a part of your identity. When income and its distribution is well maintained, you should have access to quality healthcare, education, nutritious food, and housing. Income insecurity can cause a lot of stress. People of various races can experience institutionalized discrimination, segregation between groups, internalized racism. The social safety net refers to the various government benefits, programs, and supports that protect people from extreme poverty during various changes in their lives. Social exclusion consists of multidimensional process driven by unequal power relationships in economical, political, social, and cultural settings, creating unequal opportunities. Insecure employment often consists of intense work with irregular working hours. Intense working conditions can impact the quality of life. As an educator, in order to combat the social economic status and break down barriers of social determinants of health, it's important to follow the research. Researchers have argued that classroom environment plays an important role in outcomes. Students who are randomly assigned to a higher quality of classroom were more likely to attend college, save more for retirement, and live in better neighborhoods. Research continues to link lower socioeconomic status to lower academic achievement and lower academic progress. Children in low socioeconomic families enter high school with average literacy skills 5 years behind those in high-income families. Social class has been shown to be a significant factor in influencing career aspirations, trajectory, and achievement. All of the social determinants of health are interlinked, and therefore when one suffers, they all suffer, and therefore your overall health is not at 100%. You should always consider the social economic status in your education, practice, and research efforts. Stay up to date on legislations and policies that explore and eliminate socioeconomic disparities.